567,715. That's how many homeless people the U.S. Department of Housing and Urban Development counted on a cold January night in 2019.
More than 500,000 Americans are homeless on any given night. But on the West Coast, the problem has grown worse in recent years.
Things haven't improved with the COVID-19 pandemic in 2020. Homelessness is on the rise in America.
San Francisco is rushing to contain a coronavirus outbreak that hit its biggest homeless shelter.
The homeless population in the county is up 13% from last year, as the city of LA saw a 14% jump.
Homelessness is growing, and governments have done too little, too late.
There is no doubt that the homeless are stigmatized. And all too often, we conflate the issue with mental health, or we just blame the victim.
Most people blame homelessness on the person, that they're a bum, or they're lazy, or they made bad decisions. If homelessness was a punishment for bad decisions, we'd all be homeless.
But this is a complex issue, and no two stories are alike.
There are actually a huge range of forces that often kind of come together and compound one another when it comes to how an individual falls into homelessness.
But how did we get here? How did a nation with such wealth and prosperity wind up with 500,000 people on the streets? And more importantly, what can we do about it?
It really is an urgent problem, and there's no reason that we shouldn't fix it.
I zoomed in with a journalist, 2 nonprofit execs, and a formerly displaced activist to better understand the confounding issue of America's homeless. Before we can understand American homelessness, we need to know a little bit about its origins.
In America, a lot of scholars look to the period immediately following the Civil War as the emergence of homelessness. A lot of veterans were returning from the war and returning to very overcrowded, industrializing cities that were very short on housing. Ever since then, there's been a population of people in America who have not necessarily fit into the sort of standard economic narrative. Fields like logging, fishing, mining, they wouldn't really have what we would think of as a stable home. Many people who were what we would call homeless actually did have shelter in places like single-room occupancy, apartments and hotels, in what they would call flop houses. In the 1950s and 60s, there was, at that time, urban renewal in cities. So there were just, numerically speaking, a lot fewer of these sort of transitional, very inexpensive housing options. A lot of low-income minority neighborhoods in American cities were ripped apart. A lot of the housing that existed in those neighborhoods was also gone. You have more deinstitutionalization of people experiencing mental illness, starting in the late 70s and 80s. The Department of Housing and Urban Development is getting defunded to a significant degree. And then just deindustrialization and rising economic inequality created a larger population of people that are sort of living in extreme poverty.
Now that, of course, is a very abridged version of the history of American homelessness. But the main takeaway seems to be that there is no one cause of the problem.
The reason that people fall into homelessness is that there's basically a series of unfortunate events that befall them. Some of those include losing a job. They include domestic violence. That's a leading issue for women in particular, and families. Returning from war and experiencing post-traumatic stress, losing benefits, whether healthcare or welfare, having a health problem that costs a huge amount of money and bankrupts somebody. If you mix one of those things, or add multiple of those forces together, add in addiction or mental health issues.
While a multitude of factors can and do contribute to homelessness, what it really boils down to is right in the name: homes.
The truth is, the leading cause of homelessness is the lack of affordable housing.
People are not earning enough money to pay for the housing that's available, essentially.
There are approximately 11 million low-income renters in America. Research from the Federal Reserve found that 59% of Americans are one paycheck away from being homeless.
for every 10 of the lowest income renters, there's fewer than 4 apartments that are affordable to them. And so because there's such a shortage, we have nearly 8 million of the lowest income renter households, families, who are paying at least half of their income towards their rent. And many are paying much more. They're paying 60, 70, 80% of their income just to keep a roof over their heads.
So it's sort of like a game of musical chairs. You have the chairs are getting pulled away, and there are just more people than there are chairs to sit in.
COVID-19 has proven to be the straw that broke the camel's back for many of these struggling households.
I would say that COVID-19 has exacerbated the underlying crisis of affordable housing and the tremendous racial disparities in who is most harmed by the housing crisis. When you have such limited income to begin with, and you're paying so much of it to keep a roof over your head, you are always one financial shock away from missing rent and potentially facing eviction and, in worst cases, becoming homeless. So for many of these same households, the coronavirus is that financial emergency. They've lost jobs, they've lost hours at work, they've lost wages. It's harder than ever for them to cobble together what they need to make rent.
A Columbia University economist predicted a 40 to 45% increase in homelessness by the end of 2020. This is due to both the newly displaced as well as the strain COVID-19 has put on existing homeless communities.
COVID has definitely had an effect on the homelessness system. Shelters have had to follow the CDC guidance on social distancing. So they've essentially had to decompress or thin out their shelters. They can't serve as many people. Often they're serving half the number of people that they used to serve.
But there is a silver lining here. COVID-19, while devastating, has demonstrated what's possible when we mobilize to help the most vulnerable among us.
There's also now a lot more creative thinking around what to do to create more housing and more opportunities for safe places for homeless people to stay. There's been more of an embrace of sanctioned encampments, which are essentially places where local governments set up security and bathrooms and facilities to help and then allow homeless people to come. The other big thing is hotels were emptied out because tourists disappeared during COVID. And so a lot of cities started housing homeless people in those empty hotels.
Hundreds of men have moved from homeless shelters to a fancy hotel.
I called the Lucerne Hotel. They said they are not taking reservations until at least December.
It seems like it's a pretty successful way to actually prevent mass outbreaks among the homeless population.
One thing the coronavirus has shown is that governments, if they want to, can work with homeless service providers and increase the urgency and create programs to get people off the streets.
But clearly, we as a country are not doing enough.
We can end homelessness. We actually know how to end homelessness, and we've known how to end homelessness for a long time. The problem is there's not the public and political will to push all the policy change forward to create more affordable housing and to create programs in support of housing to get homeless people off the streets in the numbers that we need to get them off the streets to end homelessness.
I think there is a widespread sense among people who work in homelessness services that there isn't enough money devoted to this. And the top line answer is that it's such a big and complicated problem that there are several levers that need to be pulled from a policy perspective.
There's generally bipartisan understanding that we have a homelessness crisis that is unacceptable. There's generally a bipartisan understanding that we have a shortage of affordable apartments for the lowest income people. Where there tends to be a split is whether there's a willingness to fund the investments that are needed to alleviate the problems.
The major way that you're going to end homelessness by getting people into housing as quickly as possible. And since these are very poor people and they can't afford most housing. We're going to need housing subsidies to accomplish that. Many people, the majority of people who become homeless actually do exit homelessness. They get back on their feet, they find a job, and they don't enter the homeless system again. And it's not a long-term, lifetime sentence being homeless. So we have to remember that. It's something that for most people is a shorter-term experience.